Welcome to the first IBP Bytes recording, a series of short interviews with Imperial academics providing an insight into their research and how new technologies and innovations might impact business and society. Monitoring our whereabouts asks important questions about privacy and anonymity. Our expert, Professor Yves-Alexandre de Montjoye, is a lecturer in the Department of Computing and leads the Computational Privacy Group at Imperial's Data Science Institute. And I'm delighted to be joined by him today. Yves-Alexandre, when you were at the World Economic Forum in Davos earlier this year, you made some really eloquent points for the need to be aware of anonymity in data. And you shared your findings that with relatively few data points, anonymized data could be linked to particular individuals. Contact tracing has proven to be an effective intervention for controlling the spread of COVID-19, but has also raised some questions around data privacy. Could you perhaps explain how contact tracing works and what technological solutions are available?
Sure. Contact tracing includes like a broad, set of potential applications. I think I would really focus on what is absolutely core to the application, which is very much, you are walking around, and if at some point you get sick, can we find a way to trace back and look at the people you have been in close contact with over the period of time that you might have been infectious and might have transmitted the disease to them? I mean, both location and Bluetooth were considered at first. I think at this point, most applications are really focusing on dedicated apps using Bluetooth that would basically try to monitor the proximity between your phone and other people's phone for you to record this information, for both phones to record this information, and then for this information to be made available later on, either in centralized or decentralized model, to allow people to know that they have been in close contact with someone who was infectious, and as well as provide them with recommendations for next steps from, be careful, FYI, and you were in close contact for quite a while, might be okay. So if you have symptoms, then you should get tested. Or maybe you were in close contact for a long period of time. It's very likely you've been infected. You should probably come and get tested now.
Okay. Picked up a lot of people have been saying that Bluetooth might be less invasive than collection location data. Is this true or is it a myth?
I mean, it's quite interesting. I think from a privacy perspective, it depends. I think it's like, it's the same thing that this whole debate on centralized versus decentralized. I think, at the end of the day, you really have to look at the entire data collection and the entire system being deployed, what it does and what the risks are, and do an analysis to be able to truly say, okay, this is good, this is better than this, or this design is strictly inferior to another design. It's a very unsatisfying answer, but you need to go beyond centralized, decentralized, or location and Bluetooth. And interestingly, Bluetooth alone is not necessarily, less invasive. When you think about it, right, it's like, oh, sure, location really tells me context, right? It tells me where you were and at what time. But Bluetooth, on the other hand, basically tells me, well, this is a phone and you've been spending at that time, quite an extended period of time very close to that phone or there are information like this. So again, it's literally, it's the offline version of your social network, right? It's literally every single interaction in person you were in close contact with and for long. So, even from the sensitivity of the information per se, I would not necessarily say that Bluetooth is necessarily less, invasive, intrusive, sensitive than location per se. And on the anonymity side, similarly, right, we proposed pre-Cambridge Analytica, research trying to quantify what we call then basically node-based intrusion attacks, which is basically can we, in our connected societies, and this was pre-Cambridge Analytica, leverage the fact that we are fairly connected to one another, and can I leverage this connectivity to have a network effect when I carry out privacy attacks? And basically, this is all from Cambridge Analytica. You went from a small number of profiles to a small number of people who installed the app to a large number of profiles who were collected This is how in the NSA case, it was like 2 hubs. Basically, you could surveil actually quite a big fraction of mobile phones. In the case of contact tracing, actually pre this entire discussion, I think in 2018, we actually proposed literally this as an attack in which a small number of devices would basically start recording the Bluetooth information of phones around them, along with their own location, and upload this to a centralized server. And then literally the server could use small number of phones that would have like, a compromised version of the app, for example, and basically start recording people's location through Bluetooth, right? Because if you and I, if my phone sees your Bluetooth identifier and reports the time along with your Bluetooth ID and my location, then they know that you were, at this place at this time because I recorded you being there. And basically what we showed, and again, this is, I really want to emphasize, this is not like, an attack that we are proposing against, the system that is deployed by NHS6 or the Google, Apple, or any other system. It's more like a thought experiment to show that Bluetooth is not necessarily safer. And basically what we showed is that even in the case of London, which is a fairly dense city, like having a small number of phones being compromised would actually allow you to monitor the location under this thought experiment and attack model of a fairly large fraction of the population. And if I remember the number correctly, it's like 1% the phones being compromised, so 1% of the phone recording the information, their location, sending it to the centralized server would actually allow you to infer the hourly location of 50% of the London population. So again, like it was a thought experiment, but we need to try to show the network effect that could be at play when it comes to privacy, and that was pre-contact tracing.
That's interesting. And does this work on all phones?
So the Google Apple one would work on all phones. I think the version that the NHS has been proposing. Again, I mean, there have been debates on how, they could basically do it in the background on Apple. I think there has been a big debate on whether you would go for the decentralized model proposed by Google and Apple, or the way the NHS6 went, which is to develop their own with potential issues for Apple devices. I think that's one. I think more important though is in the question of the utilities, like can we cover a significant fraction of the population, and can we make sure so that the people who are at risk will be able to be notified? And I think when you start looking at, sure, it's Apple and Android, yes or no, but also you have, for example, the elderlies, right? When you look at statistics here in the UK, the percentage of smartphone ownership, when you're 55 plus, it's actually fairly low, which is one of the concerns that people have been bringing forward on top of privacy, on basically the utility or efficient digital contact tracing would be, as opposed to low tech calling people contact tracing.
As you say, I mean, we almost take smartphones for granted in this country. What happens if you live in a part of the world where you don't have access to smartphones and that technology so readily?
No, that would be an issue. But again, I mean, at the very beginning, when people started to talk about contact tracing, you had up and downs basically in terms of are we how excited are we about this technology, right? And I think even in the privacy community, at first, kind of a fear that we would end up with a nightmare scenario, or what I call the nightmare scenario, which is because it's a pandemic, then we should completely forgo privacy and follow an op-ed in the New York Times who said we should pause privacy law and basically have a device on your phone that records everything it can because of the pandemic. The good thing is I think we passed this both on the privacy front and the utility. I think on privacy, a lot of good solutions are on the table. Now the main question is really the effectiveness of some of those solutions. I think at the beginning, again, people were very excited and this is going to be perfect. I think now increasingly in England and Europe in general, I think digital contact tracing is a plus on top of a lot of other measures, including manual contact tracing. And some countries, like my home country of Belgium, even decided to at the moment, basically pause digital contact tracing and rely exclusively on manual contact tracing. They're developing the app, but they're keeping it as a second option if need be first trying to see and invest resources on manual contact tracing.
And what about the other side of the equation, the privacy risks? What are the elements that we really need people to trust that this data will be used in the right way?
Yeah, I mean, that's a big one, right? I think beyond the centralized, decentralized, what is good, I think it's really important to emphasize both that I think, we're past the nightmare scenario. I think there's a lot of good solutions on the table. I think it's a question of what do you prioritize and what is needed from an epidemiological standpoint. We're in a quite good place. The main thing was really transparency. It's like now we have a solution. Choices have been made. The code, and I really applaud NHS6 for doing this. The code has been published. You have independent analysis of the NHS6 app, and so now we can really have a debate on whether this is the risk. Basically, I mean, it's the benefit or the risk, right? At some point, with a specific solution, every solution carries risk independently of the model you use. And then now it's really a question of, at this point, is it necessary? Is the risk worth it? And I think that's a debate that's very much happening at the moment in Parliament, which I think is really good.
Absolutely. And how do we weigh the critically important need to monitor and extinguish the pandemic with our inherent distrust for governments or for Google and other data-rich corporations?
It's again, I mean, like trust is one of those elements. I think people have been making argument on both sides. On the one hand, I mean, some people distrust. I mean, it's very clear when you look at the debates, right, that there is an element of who do you trust, right, and how do you prioritize some of the risks, right? When you look at some of the risk of centralized versus decentralized, the centralized is what NHS6 or France have been going for. The decentralized is the Google Apple model, but also a model that seems to have been adopted by Switzerland and other countries. Both of them basically make different assumptions on what the risks are and who do you decide to trust. I think both the UK and France decided to trust the government or the NHS a bit more. Decentralized tends to distrust the government a bit more and trust users a bit more, but it opens up new risk, right? In the decentralized model, some of the concern around the fact that without going into the details, if less of the mechanism is happening on the centralized server as opposed to your phone, the more happens on your phone, the more you as a user have access to, and that also carries risk, right? In terms of you being able to learn, who might have infected you. Attacks people have been proposing, including, if I start installing another app, can I start building a heat map, basically, of where infected people would be hanging out and then publish this map. So, both the centralized and decentralized have kind of benefits, both from a privacy and a utility perspective, as well as risks. And now, again, it's very much a question of today in England, with the solution that is on the table, do we think that basically the risks are more of the benefit that it's going to bring in fighting this disease?
Well, thank you so much for your time today, Yves-Alexandre. Really, really appreciate it. Thank you.
Of course, my pleasure. Thanks for the invitation.